NHS Forth Valley has been, as we have across Scotland, been really focusing on how we prevent pressure injuries. We absolutely believe that we can do this, and pressure injuries is avoidable harm. Just over the last year or so, we've really made an impact around community and those who wear nursing in the community.
As part of the Scottish Patient Safety Programme, we have done a lot of work around tissue viability and pressure ulcer prevention. We were the pilot ward for the skin record check chart. We discussed it every day at our daily safety brief, so that all of the staff were aware of what we were trying to achieve.
My experience really began once I got into the wards, because before that I was kind of out of my mind. I got septicemia and I didn't remember at all what was happening to me. So when I came up to the ward, I discovered that I had compression boots on, and they're to keep the circulation flowing in extremities, and they were absolutely terrific.
It's all about patient safety. It's all about making sure our patients do not sustain any harm while in our care. We have now been 307 days without any pressure ulcers on A31.
So we created a daily skin record check, the senior charge nurse and myself, and we decided to test it in her ward initially, and we have done that, and we're on our 5th PDSA, and the next step will be to move on and test it within another ward in acute services, and then move to our community colleagues.
One of the major differences between hospital and community is that we are not with the patient 24 hours a day. So in the home we have to educate the whole team, and that could be the family, it could be carers, paid or relative carers, it could be visiting teams of hospice staff, it could be any specialist nurse coming in. The GPs are pivotal in the care of the patient, although we have district nurses who work autonomously and are prescribers and have advanced skills, but all care has to be coordinated through the GP in the community. All this education has obviously improved patient care, and now when the district nurse visits the patient with her team, she can coordinate this care with this goal in mind to prevent the pressure ulcers. Although this was something we always did, it's now a highlighted situation, and it's therefore important for the nurse when she's out in the patient's home to make sure that everyone involved, the family, the carers, the paid carers, the specialist teams, all have the same goal in mind, preventing pressure ulcers. And as we work together across health and social care integration with our partners in care, we believe that we can make huge reductions in avoidable pressure injuries, and we are absolutely aiming to be world class. We know that Scotland are already world class around improvement, and we believe that with those who give care and receive care, we can eradicate pressure injuries across all settings, and I know that Scotland is determined to do that.